The ability to detect new nevi or changes in pre-existing nevi is critical for the early detection of melanoma. Equally, the ability to demonstrate stability or a lack of change in nevi provides reassurance for both patients and doctors alike. Melanoma surveillance photography is a comprehensive surveillance method. It combines 2D or 3D total body photography technology to capture the whole skin surface, and it is used alongside digital dermoscopy. Dermoscopy images can be captured digitally and tagged to the 2D or 3D total body image for surveillance of individual nevi over time. Baseline total body photography is a reference point for ongoing skin cancer surveillance in high-risk groups and is required for objective confirmation or change, as well as detection of new lesions. In case of 3D total body photography, once the photo is taken, the system constructs a digital 3D model of the person, we call it an avatar, with detailed high-resolution reproduction of the total skin surface. We want to test whether melanoma surveillance with baseline total body photography, either 2D or 3D with tagged dermoscopic images, results in improved diagnostic accuracy and earlier detection of melanoma compared to clinical surveillance without baseline photography. Of course, this is a major aim. However, we are also interested in whether there is a reduced number of unnecessary biopsies in high-risk individuals, which can be reduced using melanoma surveillance photography.
The Vectra offers 360-degree imaging of all exposed surfaces of the skin. The Vectra is made up of 92 digital cameras, which are all embedded in the two frames of the Vectra. The 92 cameras capture an image simultaneously and then stitch each of these individual images together to build a 3D avatar of the patient, where we are able to compare more than 95% of the body's skin surface.